And you're ready?
Okay. Good afternoon, everyone. On behalf of Chairman Barnes, I want to welcome everyone to the House Appropriations Committee, and thank you very much to the Appropriations Committee for great work on the floor. We're going to go ahead and get started. Our first bill is Senate Bill 373, Senator Bidel, State Personnel, BWI Airport Rescue, Fire and Rescue Department Collective Bargaining on Arbitration Process. This is a sponsor-only bill, so Chairwoman Bidel, thank you very much for being here.
Thank you, Mr. Vice Chair and members of the Appropriations Committee. I know you've had a long day, and I appreciate you hearing me first. I'm trying to run a voting session. We're still finishing up our bill hearings, and we have a voting session. But you have heard Senate Bill 373. You've heard the cross-file. And this is the bill that allows the BWI firefighters to have collective bargaining. First, I want to say that all the surrounding fire departments to BWI have collective bargaining with binding arbitration. So this is 100 firefighters. Their issue is not their salary. Their issue is working conditions. And I could show you emails that would just surprise you that a human resource person could respond to public safety personnel like they have in that fire department. What I understand is that your bill, your version of the bill that was Delegate Pruski's bill, you put an amendment about constitutional, needing a constitutional amendment. Because of the amendment we put on the bill, you do not need a constitutional amendment because we say that it's subject to the state budget. It's subject to the governor's budget or the state budget. So you don't need a constitutional amendment. It's not about salary. It's not financial. It's strictly about working conditions, and that's why they agreed to having the limitations to the state budget. So, like I said, you've heard the bill. I would really appreciate your support, your favorable report on this bill, the way it came to you from the Senate. Thank you.
Great. Thank you very much, Chairwoman Bidel. Are there any questions for the bill sponsor on this bill? Great. Thank you very much.
Thank you.
Appreciate you. See you later. All right. That concludes the bill hearing for the Senate Bill 373. The committee will now move on to Senate Bill 270, State Treasurer Board of Trustees of the Maryland Teachers and State Employees Supplemental Retirement Plans Automatic Enrollment. Treasurer Davis, thank you very much for being here.
Thank you very much, Mr. Vice Chairman. You all have my written testimony. I'm not going to go back over and you've heard this bill before. This is, while it's not listed as a cross-file, it's identical at this point. Again, you know my feelings on it. I think our citizens need this bill. I think our workers need this bill, but it's ultimately your decision. So I would request a favorable report.
Great. Thank you very much, Treasurer Davis. Are there any questions for Treasurer Davis on this bill? Okay, great. Thank you very much. That concludes the bill hearing for Senate Bill 270. The committee will now move on to Senate Bill 62, which is Senator Lewis Task Force on Education Funding and Student Population Growth. Senator Lewis, this is a sponsor-only bill.
I am. For the record, Senator Karen Lewis Young from Frederick. SB 62 establishes a task force on education funding and student population growth. It was inspired by a phenomenon that we witnessed for a lagging effect between student headcount and when the actual fiscal budget goes into effect. For example, there are some LEAs that are funding as many as 1,000 students or more, 100% themselves because of growth. We have historically relooked the funding formula roughly every 4 to 5 years. We did it in 2017. We did it again in 2021. A lot of change since that time. We recognize that financially, adjustments might be difficult at this point in time. Nevertheless, we do believe it's imperative to look at these kind of trends, look at best practices around the nation and see what we can learn from them, whether it be timing or adjustment or future planning. We believe a work group is important. Interestingly enough, some data came out just within the past week or two about growth in Maryland. Now, not student population, but population overall. And every county and the city of Baltimore is actually growing in population with the exception of Garrett and Allegheny counties. So presumably there would be a correlation with student population growth as well. So recommending setting up this task force, we may or may not take the recommendations depending upon what they are and the financial impact. But I do seek your approval in examining this issue because certainly things have changed since 2021. Thank you.
Great. Thank you very much, Senator, for presenting the bill. Are there any questions for the bill sponsor on this bill? Great. Thank you very much. That concludes the bill hearing. The committee will now move on to Senate Bill 396, Senator McKay, Public Safety Officer, Performance of Duty, Death Benefits, sponsor only.
Thank you, Mr. Chair. Hello, committee. He's back. Senator Mike McKay, representing Appalachia, Maryland, to present Senate Bill 396. This bill is basically in the same posture as House Bill 76, which you all passed out and passed on the floor. Does have an amendment, but I do believe that conforms with the existing bill already. With that being said, hope you all have an awesome and wonderful day, especially if you don't have to ask me any questions.
Thank you very much, Senator. Are there any questions for the senator on this bill for Senate Bill 396? Okay, thank you very much. That concludes the bill hearing for Senate Bill 396. The committee will now move on to Senate Bill 750, Senator Kramer, State Personnel Collective Bargaining Part-Time Faculty, sponsor only.
And good afternoon to you, Mr. Chair, members of the committee. I do not envy the day you just put in on the floor. Ben Kramer here to introduce Senate Bill 750. Colleagues, this is the cross-file to House Bill 661. You've heard and you had a hearing on it. Just as a quick recap, this is a bill that would have, had it passed the way it should have, provided the opportunity for the hardworking women and men at our university system here in the state to avail themselves of collective bargaining were they to decide to do so. Unfortunately, the bill went down an alleyway over in the Senate, and when it came back out onto the main street again, it was a very different bill. And it only provided this opportunity for part-time faculty, and I suspect that the university system had its thumb on some of the definitions as to what is part-time. So at this point, I'm not even sure that the folks who supported the bill initially are still supporting it. I certainly will, back whatever it is that our hardworking faculty members want to do with the bill at this point. And that's all I got for you, Mr. Chair, and happy to answer any questions.
Great. Thank you very much, Senator Kramer. Are there any questions on Senate Bill 750? Great. Thank you very much. That concludes the bill hearing for
Thank you. You all enjoy what you got left of this afternoon.
You too. The committee will now move on to Senate Bill 523, Senator Charles, State Employees Cancer Screening Paid Leave, sponsor only.
Good afternoon, Mr. Chair and honorable members of the Appropriations Committee. For the record, I am Senator Nick Charles, and I'm testifying in support of Senate Bill 523. This bill provides state employees with up to 4 hours of paid leave annually for cancer screenings. The cross-file of this is House Bill 914, which was introduced by Delegate Vogel. The importance of this bill is really about early detection. It's one of the most effective ways to improve cancer survival rates. Many individuals delay or forego screenings due to concerns about missing work or financial strain. Each year, over 31,000 Marylanders are diagnosed with invasive cancer and over 10,000 die from the disease. So early detection through regular screenings is crucial as it significantly increases chances of proper treatment and survival. Maryland ranks 16th for the rate of new cancer cases, but only 23rd for screenings and 26th for the early diagnosis out of 50 states. So early detection through screenings can save lives, and technological advancements and effective policies have led to significant decreases in mortality rates. The economic benefits of cancer screenings offer significant economic advantages. For Maryland, catching cancer early when treatment is less costly and survival rates are higher can strengthen our workforce and reduce health-related expenditures. Senate Bill 523 directly addresses the issue by providing state employees with dedicated paid time off for their cancer screenings. The bill grants employees up to 4 hours of paid leave in a 12-month period for cancer screenings. It requires prior approval from the appointing authority to ensure leave is used appropriately, and this leave eliminates barriers to accessing preventative health care, allowing workers to attend screenings without sacrificing standard leave or missing out on life-saving services. This policy has shown promises in cities like Baltimore City already, in states like Virginia, Delaware, and New York. New York's program for paid leave for health-related needs has led to increased screening rates and reduced health care costs, especially for low-income families. Data from the National Health Interview Survey in 2015 shows employees with paid sick leave are significantly less likely to receive preventative services like cancer screenings. Our call to action is to provide paid leave for cancer screenings, which is a proactive approach that demonstrates Maryland's commitment to the health and well-being of its workforce. This legislation sets a powerful precedent by showing all Marylanders the importance of cancer screenings, with state employees leading the way. I firmly urge a favorable report on this progressive piece of legislation. Thank you.
Thank you very much, Senator Charles. Are there any questions for Senator Charles on this bill? That concludes the bill hearing for Senate Bill 523. Committee will now move on to Senate Bill 597. Senator Quarterman, Higher Education, Maryland Graduate and Professional Scholarship Program, eligible institutions, sponsor only.
Thank you, Mr. Chair. Members of the committee, for the record, Senator Paul Quarterman, District 2, representing Washington and Frederick counties. Thank you for the opportunity to present Bill 597. You guys are familiar with this bill. I won't bore you with the details. It just adds the Meredith School, the med school that's being added there to professional scholarships. You guys had the cross file. It passed 23-0, 135 on the floor. We appreciate a favorable report. Thank you.
Great. Thank you very much. Have a great day. The committee will now move on to Senate Bill 358, and we have on behalf of Senator King for the Maryland Deaf Culture Digital Library Funding and Budget Submission, Ms. Patty.
Mr. Chair, Vice Chair, members of the committee, Patty Horton for Senator King. Senate Bill 358 is an exact cross-file of Delegate Spiegel's House Bill 678, which was unanimously passed by this committee, and so on behalf of Senator King, I respectfully request a favorable report.
Great. Thank you very much, Ms. Patty. Are there any questions for Ms. Patty? All right, great job, Miss Patty. All right, have a great day. Yay, Miss Patty. Okay, here we go. Next, we'll move on to Miss Georgie for Senator Zucker, Senate Bill 603, Senator Zucker, University of Maryland College Park Campus TERP Succeed Program, funding Miss Georgie Jones.
Good evening, Mr. Chair, Vice Chair, and members of the distinguished members of the committee. On behalf of Senator Zucker, I'm Georgie Jones, and I'm here to testify on Senate Bill 603. Senate Bill 603 is an exact cross-file of Delegate Wallach's House Bill 458. Senate Bill 603 passed the Senate unanimously, and I'm here to respectfully request a favorable report.
Great, Georgie. Great. One more. Okay. First of all, any questions for Ms. Georgie Jones on Senate Bill 603? Okay. The committee will now move on to Senate Bill 765, presented by Ms. Georgie Jones.
Mr. Chair, Vice Chair, distinguished members of the committee, my name is Georgie Jones. I'm here on behalf of Senator Zucker to testify on Senate Bill 765. 765 is an exact cross-file of House Bill 809. Both Senate Bill 765 and House Bill 809 passed their respective chambers unanimously, so I'm here to request a favorable report.
Great, sounds great. Any questions for Ms. Georgie Jones on Senate Bill 765? Okay, that concludes the bill hearing for Senate 65. The committee will now move on to Senate Bill 278, presented by Ms. Verna Labeer.
Good afternoon, Chair and members of the Appropriations Committee. Representing Senator Brian Simonaire, my name is Verna Leber, and Senator Simonaire is testifying in another committee. Senate Bill 278 is identical to House Bill 691, which you all heard and passed out of this committee. Thank you for your time, and I ask for your favorable consideration.
Great, thank you very much. Any questions for Ms. Leber? Okay, that concludes the bill hearing for Senate Bill 278. The committee will now move on to, let's do the.
We got to do technology. You want to do some of these?
Sure. We'll go on to Senate Bill 200, Departmental Bill, Board of Trustees of the Maryland Teachers and State Employees Supplemental Retirement Plans Renaming.
You want to read it?
Yep, and that is the bill. This is Senate Bill 200. Okay. Okay, any questions on that? Okay, the committee, that concludes the bill hearing for Senate Bill 200. The committee will now move on to Senate Bill 208. We have Secretary Beatty here for that one. Okay, Secretary Beatty. It's the Human Services Maryland Assistive Technology Program Establishment. Thank you very much, Secretary Beatty, for being here.
Thank you. Good afternoon, Vice Chair Chang and members of the Appropriations Committee. I am Carol Beatty. I'm the Secretary of the Maryland Department of Disabilities. Senate Bill 208 establishes the Department of Disabilities Maryland Assisted Technology Program and state law. SB 208 is identical to House Bill 214, which was heard by the Appropriations Committee. No amendments have been made to either of these bills. HB 214 received a unanimous favorable report from the Appropriations Committee and passed the House with overwhelming support. Senate Bill 208 received a unanimous favorable report from the Senate Finance Committee and passed the Senate with unanimous support. So thank you, and I ask you for a favorable report for Senate Bill 208.
Thank you very much, Secretary Beatty. Are there any questions for Secretary Beatty on Senate Bill 208? Great, that concludes the bill hearing for Senate Bill 208. The committee will now move on to Senate Bill 230. It is a departmental bill, and we have a representative here for the Human Services Local Departments of Social Services Audits. Thank you very much for being here. See if you can state your name.
Hi, Vice Chair Chang. Melissa Bender here for the Maryland Department of Human Services. I just wanted to thank you again for passing this bill out. The identical cross-file is HB 251, which the committee heard prior to crossover, and the Senate version passed the Senate unanimously. So we would respectfully request a favorable report, and I'm happy to answer any questions. Thank you.
Great, thank you very much for presenting Senate Bill 230. Any questions? No, thank you very much. That concludes the bill hearing for Senate Bill 230. The committee will now move on to Senate Bill 246. It's a Education, Energy, and Environment, Maryland Veterans Trust Assistance to members of the Maryland National Guard. And we passed that unanimously, and that concludes the bill hearing for Senate Bill 246. The committee will now move on to Senate Bill 599, Senator Heddleman, Behavioral Health Crisis Response Grant Program Funding. And we have Ms. Mara Dunnigan, who is presenting on behalf of Senator Heddleman.
Good afternoon, Mr. Chair, Vice Chair, and esteemed members of the Appropriations Committee. Senator Heddleman sends her regrets as she is voting on the BRFA. She's sure you will understand the importance of her not attending today's hearing. I am pleased to present SB 599, Behavioral Health Crisis Grant Program Funding. This legislation takes a critical step to ensuring behavioral health care is protected in Maryland at all levels by securing dedicated funding to essential services. These services directly translate into reduced emergency room department, hospital, and criminal justice costs. Even though it's a $5 million mandatory appropriation, it's an investment at the local level for these essential services. Eliminating funding for this program will reverse years of effort to expand and strengthen Maryland's behavioral health crisis response system. For example, in Prince George's County, the mobile crisis team provides over 1,000 dispatches every year, primarily for psychiatric emergencies, behavioral emergencies, and on suicidal ideation. They serve youth and adults, many of whom would have nowhere to turn but local hospitals without these services. It's estimated that 2 mobile crisis teams would be laid off if the funding ended. These essential behavioral health services are boots on the ground in every county across the state. Baltimore County, Carroll, Frederick, Hartford, Midshore, examples across the board. Without granted funding, Maryland risks backsliding on the progress we've made in improving behavioral health services, leaving countless individuals in crisis with nowhere to turn. Therefore, I urge a favorable report on SB 599.
Thank you very much for presenting the bill. Are there any questions regarding the bill on Senate Bill 599? Okay, that concludes the bill here for Senate Bill 599.
Thank you.
You're welcome. The committee will now move on to Senate Bill 511, which is a crossfile of the Delegate McCaskill. We have Senator Henson here, public senior higher education institutions, pregnant and parenting students, plan requirements. Pregnant. Pregnant and Parenting Student Support Act. Thank you, Senator Henson, for being here.
Thank you, Mr. Chairman. Thank you, colleagues. For the record, Senator Shanika Henson, on behalf of Legislative District 30, I am here to present Senate Bill 511. This is a bill that this committee is very familiar with. You all passed it unanimously out of committee in 2024, and then you all passed it unanimously as well with my wonderful cross-file, Delegate McCaskill. This bill would support pregnant and parenting college students. It came from my own personal experience of being a college student who found out I was going to be a mom on a college campus. I was 100 miles away from my family, 100 miles away from my doctors, my support system, and I know that I was blessed with great family that gave me the ability to make the best decision for myself and my family. My son is now in college himself, so I'm dealing with college from a different perspective this time now as a parent of a college student. But this bill would provide those supports for them, students who are there and figuring out what's the next best step for them. Very thankful for Delegate McCaskill for sponsoring this bill in the House and ushering it through, and I would ask for a favorable report.
Great. Thank you very much, Senator Henson. Are there any questions from members of the Appropriations Committee for Senator Henson on this bill? Okay. Thank you very much for being here. That concludes the bill hearing for Senate Bill 511. The committee will now move on to Senate Bill 623, Senator Bailey, St. Mary's County Public Facilities Bond.
Good evening, Mr. Vice Chair and distinguished members of the committee. Senator Jack Bailey, representing St. Mary's and Calvert County, District 29, for the record. This afternoon, Senate Bill 623 is a local bill that authorizes the commissioners of St. Mary's County to borrow up to $71 million to finance the construction, improvements, and development of public facilities in St. Mary's County. This bill has passed the St. Mary's County delegation and is identical to House Bill 561, which you heard earlier this session. I respectfully request a favorable report on Senate Bill 623. Thank you for your consideration.
Great. Thank you very much, Senator Bailey. This is the annual St. Mary's County Public Facilities Bond Bill. Any questions from members of the Appropriations Committee on this bill? That concludes the bill hearing for Senate Bill 623. The committee will now move on to Senate Bill 269, Senator Jackson, Maryland Community College Promise Scholarship Program and Visions. And on behalf of Senator Jackson, Delegate Harris.
Appreciate it, Vice Chair. Senate Bill 269 is the same posture as House Bill 473. It passed this committee as well as passed the House, so move favorably.
Thank you very much, Delegate Harris. Are there any questions for Delegate Harris on this bill? That concludes the bill hearing for that bill. The committee will now move on to Senate Bill 445, Senator McCray, Department of Human Services, Federal Commodities Supplemental Food Program Administration. We have a representative for Senator McCray here. Thank you for being here, sir. You proceed.
Good afternoon, dear Chair, Vice Chair, and esteemed members of the Appropriations Committee. My name is Ken Stoops, and I'm here on behalf of Senator McCray, who apologizes for not being here today. I'm testifying on Senate Bill 445. It's cross-filed with House Bill 538 under Delegate Shetty. I ask for favorable consideration of this bill.
Great. Thank you very much for presenting the bill. Are there any questions on Senate Bill 445? Okay, thank you very much. That concludes the bill hearing for Senate Bill 445. The committee will now move on to Senate Bill 1005, Senator Benson, Federally Qualified Health Centers Grant Program, Acquisition of Land, sponsor-only bill, and the cross-file was presented by Delegate Jazz Lewis of the Appropriations Committee. We have Miss Angela Johnson, who's going to be presenting on behalf of Senator Benson. Angela.
Hold on 1 second. Put this on right. Good afternoon. I'm Angela Jones. I'm testifying on behalf of Senator Joanne C. Benson, Senate Bill 1005. Good afternoon, Chair Barnes, Vice Chair Chang, and esteemed committee members. I come before you today to express my unwavering support for Senate Bill 1005. This critical legislation authorized the Board of Public Works on the recommendation of the Secretary of Health to make grants under the Federal Qualified Health Centers grant program for the acquisition of land for the construction or use of FQHCS. Federally qualified health centers are essential to the well-being of our most underserved population. They provide comprehensive, high-quality health care services to individuals and families who might otherwise go without essential medical care. By expanding the scope of the FQHC grant program to include the acquisition of land, SB 1005 will make a transformative impact on the healthcare landscape of our state. The urgency of this legislation cannot be overstated. Number one, critical healthcare access. The expansion of FQHC will ensure that more Maryland residents, regardless of the socioeconomic status, have access to affordable and comprehensive healthcare service. This is not merely a healthcare issue, it's a fundamental matter of equity and justice. Number two, economic revitalization. The establishment of new health centers will create jobs, stimulate local economies. On breath and breathe new life into communities. The economic upliftment will benefit businesses and residents alike, fostering a circle of growth and prosperity. Number three, addressing health disparities. By promoting health equity, SB 1005 will help bridge the gap in healthcare access in marginalized and underserved communities. It is our moral obligation to ensure that every resident has access to health care they need and deserve. Number four, preventive care and cost savings. FQHCS focus preventive care and managing chronic disease, which significantly improves health outcomes and reduce long-term health care costs. Expanding FQHCS will create a healthier and more resilient population. This legislation is not just a policy change, It is a bold and necessary investment in the health and well-being of our communities. It represents an opportunity to address critical gaps in our healthcare systems and to reaffirm our commitment to the principles in equity, justice, and human dignity. In conclusion, I passionately urge a favorable vote for SB 105 from the members of the Appropriation Committee. This legislation is a profound commitment to building a healthier, more equitable future for all Maryland residents. Thank you for your attention and consideration.
Thank you very much, Ms. Jones. That was beautiful. Are there any questions from members of the Appropriations Committee for Ms. Jones on Senate Bill 1005? That concludes the bill hearing for Senate Bill 1005. Have a great day, Ms. Jones. And then the committee will now move on to the last series of bills from Senate Bill 457 to Senate Bill 862, which will be presented by the Pension Subcommittee Chairwoman, Delegate Forbes.
Senate Bill 457 is the work group bill that is exactly identical to HB 584 that we passed out unanimously. Senate Bill 612 is the deferred vested former members bill that is exactly identical to HB 886 that we passed out unanimously. Senate Bill 692 is a clarification bill that's identical to HB 1034 that we passed out unanimously. Senate Bill 693 is identical to HB 1033, the reemployment earnings limitation bill that we passed out unanimously. Senate Bill 768 is the correctional officers retirement system membership clarifications bill, identical to HB 1029 that we passed out unanimously. Senate Bill 862 is the state retirement and pensions system administrative fees repeal bill, identical to HB 1072 that we passed out unanimously. SB 810 had a few clarifying amendments, but HB 1028 that we passed out unanimously will be amended to match and move forward. Thank you.
Great. Thank you very much to the subcommittee chair on this. Any questions for the subcommittee chair on the pension bills? Okay. That concludes the bill hearing for today. On behalf of Appropriations Committee Chairman Ben Barnes, everyone have a great evening. Thanks.